Experiencing any kind of back pain can be debilitating, but there are ways to prevent the onset of developing this chronic pain. We spoke with Dr. Joe Lee of Methodist Hospital in Arcadia, California, to learn what you can do to reduce or even prevent back pain that isn't caused by injury.
Back pain is very common, but there are warning signs that arise that will tell you need to seek professional help. These include unrelenting pain that doesn't respond to medications or rest, any weakness or numbness that runs down a leg or feet, trouble walking, and of course any bowel or bladder issues or warning signs that there's permanent damage going on in your spine. So there are a lot of causes of back pain. The most common is injury to the muscles, tendons, or ligaments caused by a strain or a sprain. Also, you can get a herniated disc, which happens when the outer wall of the disc becomes weak and the inner jelly starts to bulge out or even squeeze all the way through, and this can pinch on the nerves and send a lot of pain going down the area of that nerve root. Another cause is the disc can wear out, and without that padding or that shock absorption, there's a lot more stress that goes to the joints and the spine, and that can cause arthritis as well. One of the most common causes of back pain, especially in the elderly, is lumbar spinal stenosis, which with wear and tear causes a shrinking of the canal, shrinking of the tunnels for the nerves. It'll really pinch down on the nerves and send a lot of pain to the back, also weakness or even heaviness, and numbness to the legs. Most people who see me do not need surgery. It's important to realize that there's always an option. There's always something that can be done to help relieve the pain. A lot of patients come into my office and they were told that nothing can be done or they need to just live with the pain. That's not true at all. There's a lot of treatment options, and in my practice, this can range from proper medications, physical therapy, injections, and for some, surgery.
Dr. Lee explains the lifestyle changes that can help.
So for people who have back pain, I would say stay healthy and stay fit. You can do this by regular exercise and regular stretching. Also, don't smoke, as smoking has been shown to cause accelerated disc degeneration. Also avoiding high-impact activities like football or mountain biking, things that take a toll or put a lot of stress on that back. Things you can do to really keep loose, which are low impact, would be swimming, bicycling, or just a lot of walking. Staying fit and staying light or keeping that core strong will first take a lot of that extra load off of the spine. And remember, every pound you lose off of your body is at least 5 or 10 pounds off your spine because of all that torque. So if you can lose any amount of weight, that's a lot of weight taken off of the spine. And also keeping your core stronger will help to support that spine a lot better and relieve the loads on the individual parts of the spine. I usually tell my patients who have had spine surgery especially to not sit for more than 30 minutes at a time. Sitting, first of all, puts a lot of torque and a lot of stress on that low back, especially if you're reaching forward or hunched over. Secondly, when you're just sitting there and not moving around, there's not a good blood supply or good circulation going into those muscles and providing nutrients to the spine and nerves. Secondly, the muscles and joints and tendons, they tend to get very stiff very quickly. So if you sit for 9 hours a day for an office job, you're going to get very stiff, you're going to get very tired, and those muscles supporting your core and your spine are not going to get very strong at all and start to get debilitated.